All right. So, well, thank you everyone for being here. Again, we apologize for the technical mishaps. It's always the challenge when one is working with the joys of technology, and we'll definitely be talking about that throughout the webinar today. So we want to begin by thanking everyone for being here for this webinar, which is a way to underline and to talk about a recently launched resource called Digital Liaisons, Lessons Learned from Using Social Media and ICT in HIV Work. My name is Sophie Wertheimer, and I'm an independent consultant, and I had the great joy of working on the development of this resource with the ICAD team. And today on the webinar, we also have Kate Alexander, who is joining in, and as well as Robin Montgomery, both from ICAD, and hopefully Laura Keegan from HIV Edmonton, who will be speaking about the case studies that were featured on the website. So before we move forward, in terms of technical details, we've already sorted out a few in the opening minutes of the webinar. By way of participation, we certainly encourage your comments and questions throughout the webinar. There's a chat box in the right-hand side of the Adobe Connect platform where you're able to submit some questions or comments throughout the webinar. And at the end of the discussion, we'll have a formal Q&A period as well with everyone, with all our presenters. So this will be another opportunity to share comments or questions, and you can do so using the chat box at the bottom of the screen, or also use a microphone. And in order to do that, you'll have to activate the microphone function using the little microphone icon in the top left-hand of the Adobe Connect box. So right next to meeting and to the audio controls. So without further ado, I want to hand things over to Robin to give us a little word of introduction.
Thanks so much, Sophie. I think I'll keep it short for today. I'm really excited about today's webinar and super excited about this resource. There's been a tremendous amount of work that's gone into it, and I think it's very, very innovative in terms of looking at how we can maximize the technologies in order to push our messages out more clearly and across diverse geographies, communities, and households. It's been an amazing project that has spanned just a little over a year, almost. It's been a fantastic experience working closely with Sophie, as well as to a really dedicated steering committee that was made up of some of ICAD's members, being Dan Allman from the Dalla Lana School of Public Health at the University of Toronto, Dara Gordon, Laura Keegan, who we have on the phone with us today from HIV Edmonton, and Leah Morris. And then, of course, also working so closely with all of our case study partners. And if you haven't seen the resource online already, we have Blood Ties for Direction Center, the Health Initiative for Men, HIV Edmonton, Portail VIH, SIDA du Québec, and also from some of our global partners, including the Zimbabwe Young Positives. I know that we will be talking down closer to the end of the session about some of the new case studies that are going to be added, and we really encourage everyone to keep checking back with us and look forward to hearing all of your feedback. So thank you very much for joining us today, and thanks very much for Kate and Sophie for pulling this together and giving us the opportunity today to share some of our insights and lessons learned.
Thank you, Robin. So today we'll get to hear about some of our case studies, but prior to doing so, I wanted to just give you a little bit of background about the resource, how it came to be, and the process that was involved in developing it, as well as some of the key lessons, well, a few of the key lessons that have started and key themes that have started to emerge in the process of developing this resource. So certainly, I mean, in terms of background, I think we all know now that social media and ICT, i.e. information and communication technologies, are really pervasive in our society, in our world, and this across the globe. And they're being used really in countless and innovative ways, and they've really changed the way that we interact, that we communicate with one another, the way that we take care of our everyday business, our personal affairs, and of course our professional affairs as well. Certainly when it comes to media and social media and ICT, it's important to take into considerations questions of access, in that people have more or less access to these technologies depending on resources, depending on the area of the world where they are located. Even within Canada, there's big discrepancies in terms of access to high-speed internet, for example. So these are all things that affect, of course, people's ability to connect and to use these tools. But nevertheless, one point that really emerged from the process of developing this website is that people are really resourceful, and people find ways to connect and to take part in this broader dialogue. And so as service providers, for example, it's really kind of our responsibility to find ways to examine how people are finding ways to connect, and hopefully to utilize that as opportunities to connect with people that we might not be connecting with otherwise. So when it comes to sexuality, certainly I don't think anyone here will be surprised to hear that sex has moved online, and that social media and ICT are certainly being used in countless ways when it comes to the pursuit of sexual pleasure, identity, and community. And by extension, these tools offer really interesting platforms to do sexual health promotion work, and to offer diverse services to people who are living with HIV, and living with other STBBIs as well. Not to mention also the prevention and educational components and potential of these tools. So certainly the purpose of this website and of the development of this resource was really to examine how are these resources being used, and how are these tools being used by organizations, and what are some of the lessons that they can share with us and share with other individuals and other organizations who may be interested in using social media and ICT in the context of HIV-related work. In order to implement this project, there were various steps. As Robin mentioned, we worked with a steering committee who was really invaluable in providing advice and guidance as we moved forward with the process. We used a range of online tools as well, and I just wanted to flag that because it's something that comes up certainly throughout the resource. In the ICAD case study, which we'll be learning about a bit later, we look at the potential that these online tools have in terms of facilitating collaborative work practices and processes. And a lot of these tools are free. So we've mentioned a few of the ones that we've used, but we've used several others. But Slack, Skype, Google Drive, and Google Docs have been really, really helpful tools in allowing us to get this project up and running and to develop this website. In terms of understanding the landscape, we conducted a bit of a scan at the beginning of the process to look at the literature that existed on this topic, as well as existing projects and resources. And a lot of those have been shared in the resources section of the website. So again, a way to kind of identify what was already out there and what are some of the great tools that already exist, and to highlight those. And then from that, we identified a number of case studies and developed a survey as well as a way to identify further needs and projects, which allowed us again to identify some individuals that we wanted to contact for case studies. So we carried out a number of interviews with representatives of diverse organizations who have done really interesting and groundbreaking work when it comes to using social media and ICT. And they generously provided their insights and shared some of the lessons that they learned in the process of doing this work, which are shared in the case studies section of the resource. And I have an image here. If you haven't been online yet, this is what it looks like. So far, we have 6 case studies, and we have 3 more that will be forthcoming. And we'll again have the chance to hear from two of our case study participants. So I won't say too much more, but I certainly want to take this opportunity to thank all of the organizations who share their great experiences and feedback. And the purpose of this tool is really to kind of highlight those lessons and to facilitate that dialogue amongst organizations, because we use these tools so much, but we rarely take the time and step back to look at how we're using them and to share some insight and some tips on how to use these tools more effectively. So the resource was just launched in March, and we're continuing the process of promoting it and getting it out there. The nice thing about a website is that it's something that's flexible and can be adapted and changed as we move forward, so we can add new resources and new case studies. And hopefully it's something that will continue to be organic and to move forward in the future. I did want to highlight just a few of the key themes that have emerged from the development of this resource, and then we'll explore these further when we're discussing the case studies. But I wanted to bring up maybe 3 or 4 key points that have emerged in all of these, the research and the discussions with our key informants who contributed the case studies. And certainly there's this idea that social media is social, so that really you're kind of, fitting that these activities fit into the broader work of an organization or of a group or of a community, and that you really need to use these as ways to kind of connect with the community. And this is a quote from Laura, who will be talking about the HIV Edmonton case study a little bit later during this webinar. But we really, really like this quote, that you have to think of social media as a party. If you don't speak to anyone, or if you spend the whole time talking about yourself, you're not going to be very popular. And that was a point that's come out throughout the resource, that these are really opportunities, not only, for example, in social media and organizing campaigns. It's not only an opportunity to showcase your work and to share your work, but it's an opportunity to take part in dialogues that are happening at the community level, whether it be with other community-based organizations, and even more importantly, with the people that you're trying to reach, who are on these platforms, sharing information, organizing themselves, organizing events, mobilizing. And when you're kind of taking part in these activities as an organization, it's really important to take part in this broader dialogue and to really look at what's happening around you in this virtual sphere, and take advantage of all those opportunities and actively participate in them. Another point that came out pretty strongly throughout all of the case studies and throughout the process is this idea that you really need to plan and to monitor social media and ICT activities quite carefully. There's perhaps a reflex or a tendency to maybe jump on using new social media platforms as they appear because everyone's on them and they're free and they're seemingly easy to use. But one point that's really emerged quite strongly in this process is that you really need to think and plan like you would with any other type of activity, any other type of project. It's really useful to give some thought ahead of time, and as you're moving forward with your social media and ICT work, to make sure that you're doing it strategically, and that you're carefully planning both ahead of time and as it unfolds as well. You're monitoring to make sure that you're managing to reach the audience that you want to reach, that you're managing to do things effectively and in a way that speaks to the individuals and the communities that you're trying to reach. And one important element to take into consideration, to maintain throughout the process, is this idea of consultation. There's, of course, different ways of doing that and of getting feedback from your audience and from the people that you're trying to reach. But that's a really key element, that you need to make sure that you're consulting people ahead of time to find out what social media and tools and ICT tools are using and how, to make sure that you're using platforms and launching into activities that are actually relevant to the audiences that you're trying to reach. In many cases, from the consultation process, when we spoke to some of our case study interviewees, a lot of the ideas for the campaigns and the content itself came from this consultation process. So not only are you using tools that are relevant and that make sense to the people that you're trying to reach, but you're using their language as well, and perhaps speaking in ways that are really relevant and that may be coming directly from the community itself. And certainly, I think in the history of HIV, we've certainly seen that the interventions that come from the community itself tend to be the ones that are the most effective. So that's something that applies, again, in the context of social media and ICT. Any type of virtual work benefits from being carefully planned, monitored, and making sure that that includes a strong consultation component and that you're speaking and engaging with the people that you're trying to reach throughout the process. Another really key lesson that's emerged is this question of security. And I think that's something that probably will need a growing amount of attention as organizations and as individuals are using social media and ICT more and more. There's a lot of important safety considerations that don't necessarily apply in in-person services. Or when people are coming to get services in a geographical or in an office, for example. Of course, we've seen in the history of HIV that there's a lot of questions that need to be considered, how to make sure that you're protecting the individuals that you're working with, protecting the communities and the people who are coming to seek services from your organization. But that's something that takes on a really different dimension in the online sphere, partly because it's so murky and it's so transnational. Sometimes we may be using tools that are from other parts of the world or whose servers are based, for example, in the United States, which means that some of the rules and regulations and laws that are specific to the US will apply in the Canadian context, for example. So these are really important things to take into consideration, especially when you're dealing with communities who are marginalized, who may be criminalized in certain parts of the world. And that was a key point that came out throughout the discussions and the research process, that you really need to think about how you're protecting yourself, how you're protecting your staff, and very importantly, how you're protecting the people that you're working with when doing social media and ICT work, and making sure that you let people know as well that whether the service that you're offering or the interaction that you're having online, for example, whether it's anonymous, whether it's confidential, and in which ways and how the person's security might be compromised, which may limit how much they want to tell you, for example, online. For example, one organization would start having a conversation online using dating sites. And then once they had made that initial connection, they would shift the conversation either to the phone or to a direct chat messaging system. In that way, they could protect the anonymity and protect the information that was being shared with them. Because if they were sharing that information directly in the dating app, and the server was based in the US, then that meant that information could be accessed in different ways. So again, really important considerations. And in terms of strategies, again, it really depends on the intervention. It depends on where you are in the world. But we found that there are a lot of specialized experts, and it's really worth it to reach out to them. One case study noted that they'd struck up a really great partnership with a cybercrime specialist in one of the local police departments, and that person had been really, really helpful in providing them with guidance as they move forward with their activities. Similarly, I think it's important to flag all the work that's being done in the context of prevention of violence against women. There's a lot of great resources that exist around cybersecurity that have been developed in the context of gender-based violence. And so it might be worthwhile to, if this is something that interests you, to look at some of the resources that have been developed by your local organizations, and that might speak to some of the issues that are specific to your locale. And finally, another important consideration, which again is a little bit murky or is yet to be fully resolved, is this question of measuring impact. And how do you know whether what you're doing online is making a difference? Certainly the metrics and the data we collect from our websites, from our social media activities, and so on, are a good way to see if people are accessing our information in the first place, how people are engaging, how people are accessing those services. But that really only gives you one piece of the puzzle. It doesn't necessarily tell you if people are accessing services in person outside of these online interventions. For example, certainly in the Canadian context with regard to HIV testing, right now, in order to access an HIV test, you have to go to a location. You're not able to do it from home. So in that context, any HIV testing activities that are done online are really encouraging people to go seek services in person and to go to a clinic or to an organization where they'll be able to access this service. But it's a bit tricky to measure how effective that is and whether you can actually measure how your online interventions are affecting rates of HIV testing, and beyond that, whether people are making changes in their lives or in their how they're actually implementing that information. So again, we have some various recommendations that have come up through some of the case studies, and I think it's an area that's going to warrant more and more interest as we use these tools increasingly, and as they're being used more and more in the public health and in the community health and health promotion sectors. So that was an area that was flagged, but in terms of recommendations, I would say, well, there's still a lot to be discovered and a lot to be learned. And I think everyone who does this work has a role as well in terms of sharing evaluation results, but also sharing insights about how to measure these the impact of these endeavors as well. So with that, and perhaps we'll have an opportunity to hear, to have our case studies speak to some of these particular issues as well. But with that, I'm really happy to introduce our first speaker, who's going to present on one of the case studies that was developed in the context of this website. I know we were having audio issues a little bit earlier, so hopefully we'll be able to hear Laura well. Laura Keegan is Director of Resource Development and Public Engagement at HIV Edmonton. And she kindly shared some insights that helped us to develop the case study, HIV Edmonton, a very social organization. So Laura, I will hand it over to you, hopefully. If we can
okay, I'm going to start talking. Can people hear me? Yay.
Yes, we can.
I was telling Kate that the fact that none of my electronics were working, the irony was not lost as we talk about digital liaisons and working with electronics and social media and computers and laptops and iPads and phones and everything under the sun. And so it's been a bit of a gong show in my office, and so I apologize for all of that. And as I say, it's a little bit ironic about how this has all turned out today, of all days. But I'm so pleased to be here to talk about this. This was an exciting project to be a part of. And I didn't actually think that HIV Edmonton would be an organization that would be highlighted. I was mostly interested in really finding out and being a part of the lessons learned around what people were doing around the world, across Canada, and I knew that I was interested in the project, but from certainly a place of wanting to help develop the tool, but also in my own life, I guess, to learn from what was out there. So I was very flattered, HIV Edmonton as an organization, to be part of this. I just wanted to outline some of the things, some of the things that we've done. You know, if for those of you that have read the outline, was that a few years ago, about 5 years ago, I started here, and our website was just abysmal, and it was really impossible to garner attention, to get the work that we needed to get done, and to get donors and have people engaged. We had this beautiful building that when people walked in were engaged and excited to be here, and there was a lot of education and advocacy and groups coming in and out, and the energy is just so fantastic. And yet our online presence was it wasn't reflective of the work and energy that this organization and the people in it are doing. So it went from a priority that was a bit of a low priority to a high priority. And at the same time, we started working on our online presence as far as our social media structure. We had been on Facebook for a while, we'd been on Twitter for a while, but there wasn't really a plan or any communication strategy. None of it was being done very strategically. We started to increase our presence. Facebook was a bit of a challenge, interestingly, because they changed the template and we were told that we had to move from being a person, which is how we had started on Facebook, was how everyone started on Facebook, and we were a person, and we had to become an organization or a page, and we lost. I feel that was a big loss for us. I loved that HIV Edmonton was a person. We could see when people's birthdays were. We had a feed that our followers, so people who were friends with us, and that's truly how I look at social media and our community, is that there were people that wanted to be friends with HIV Edmonton. And we were able to interact. When people had babies, we knew. When people had got married or engaged or had a loss, anything that they posted on their feed, we were able to comment and be engaged in a very personal way. That changed when we had to become a page, and I think this is a struggle that a lot of organizations had. So we've had to be creative about how to engage, and I'm going to be honest, one of the challenges when I think about that online presence has been that we seem to have a lot of following, but we still struggle with getting comments, having people actually speak to what we're presenting. And so I'm looking forward and feedback and everything from anyone that will listen to me to find out, is there a way to engage differently that will inspire more than just a thumbs up or, sometimes we get a love or an unhappy face, but we're not really getting the commentary that I'd love to see. Twitter, Twitter's not really a place where a lot of that happens, but it's a place where we can actually interact, where we can see what's happening in community. We do focus a lot on AIDS service organizations and what's happening, and then because we're a local AIDS service organization focused only in the work predominantly in Edmonton, we've really focused on really honing as to what's happening in the community. And then with our rebranding, we were able to have a theme that then was reflective of who we are, of our vision, which is hugely important to us, that we have a 3-line vision, and it's not news to anyone working in HIV because it came from UNAIDS, and that's the vision of zero. And you can see it there written. And that allowed us to really focus everything we communicate, everything we're doing is all about getting to that vision. So we don't have any vision, mission drift, and we're very focused. It has been, there's always challenges. You can see that we did some campaigns. We've used visuals. Visuals become more and more important all the time when you're using social media. People like a picture. And there's just an example of some of the ways, and we really want a solid picture across the board as well. So when we started our campaign, HIV Tonight, which was directed at men who have sex with men, young men who have sex with men, we wanted our site to reflect, our website to reflect the HIV Tonight move. And so everything, again, matches and is branded and drives everything back to the fact that we have one message, and that's getting to zero, and it's about HIV and prevention. And that site, we were really excited. Some of the clips that are on this page, I think, was when people were happy to see our work, and you can see that there was a tweet saying that, you know, as an immigrant young man, young gay man, this was important. And when we talked about, Sophie was talking about being able to assess or evaluate the work, and online is it's easy and it's hard all at the same time. There's these great sites where you can pull analytics and you can see how many people were there and who stayed on and who moved around the page, and you can see all of that, but what you don't see is that qualitative. Did people get tested? Did people feel heard? Were people able to connect with it? And numbers don't always tell us that. So it's nice to see when we see those comments, as you can see on that page, that reinforced that we were on the right track and at least moving in the right direction. We were amazed, well, I was amazed, I guess, in that this campaign won the Grand Clio, which is the highest award that can be given in advertising. I was very upset that we couldn't go to the Clio Awards because that looked like a big deal. But we were really, I was really surprised, and yet some people weren't as surprised because it was clean messaging, it made sense, and we had a specific audience. And so they didn't look at it as being the biggest campaign or the biggest reach. It was about, did the campaign and the advertising sort of do what it was supposed to do? Did it target that audience? And so having that reinforcement was great. But the people that mattered the most, of course, were people like the fellow on Twitter that said that it was valuable to him, because that's really where it matters the most to us. And I think one of the things that I did want to just mention is that it's a lot of work. Social media, you know, people being on Facebook, being on Twitter, being on Instagram, having a blog, all of these things, you know, to do them and do them well, it's a lot of work and a big commitment. And as Sophie mentioned, you know, you can't just talk about yourself. So it's not even just posting and being available as to what you're doing. What we learned that helped us a lot was that we really wanted to engage in what our partners, Pride Center in Edmonton here, what are they doing? They have a Queer Lens series. We like to let people know that's happening. Social groups like Fruit Loop. We have all these different things happening in the city that make it so dynamic, and these are all our partners. You know, we're all in this together. So really using social media as a way to connect the audience and to connect us. And it's been incredibly valuable to us, but I'm not going to lie, it's difficult. And I think one thing that we're looking at now is looking at how can our strategic plan moving forward incorporate more policy and where we're going. So how can it be influential, not just sort of talking about things or starting a dialogue? How can we start to move that dialogue into something around, you know, when we look at criminalization of HIV, when we look at things like PrEP and different aspects, our voice needs to be strategic and directed so that we can help use our social media platforms. We can help use that connection in that community to be able to let policymakers know that we do have backing for these things and we want to move on them. And so that's really when I look at steps forward where we're moving, is we've got this great following. Now how do we engage them, and how do we get back into, we're getting to a place where there's been some struggles with getting people and champions really talking openly. So how do we get them engaged again to move to the next steps? Because when we look at PrEP, when we look at treatment as prevention, when we look at these pieces, we have so many tools to get to the end of HIV, but we need that final push. So how do we engage that next generation to really push? So that's kind of an overview of how we got where we are. It's been sort of 4 years in the making, and we're not a big team. I'm currently as of today, a communication grant writer, fundraiser, event planner, media person of a team of one. So it's not easy, but when you know it's valuable and you know it's important, you put the energy forth. So it's doable for any agency to do it well, but it does take a commitment from a whole team. So my team sends pictures, talks to me about what's going on. We get out into the community, and I can't do it alone. So I may be the voice or the people that the person that's sitting behind the Facebook posts, but I do not do it alone. Our educators and support help a lot. So yeah, it's a team effort. So thanks, and I'll basically just hand it off so that we can, if there's specific questions, I can answer those specifically. I'm happy to do that, but and if there's anything anyone wants to hear, I'll just go from there and stop talking.
Thank you so much, Laura. That was a great presentation. In the interest of time and making sure we have enough time for our next case study, I'll propose that we move forward with the next presentation, and then we'll open it up for questions at the end of the. So thank you so much. So now I'm going to hand it over to Robin Montgomery, who's Executive Director of ICAD, and Kate Alexander, who's Public Engagement and Membership Officer at ICAD. And they're going to be talking to us about the case study, ICAD Goes Virtual.
Great. Thanks so much, Sophie. Can everyone hear me okay?
Yes.
Perfect.
I can.
Perfect. So as Sophie was mentioning, we're going to be talking today, Kate and I, about how ICAD went virtual. We've been talking about digital technologies and how they are impacting the world of work in terms of our communications with communities, with communications with our clients, with our collaborators. But we also wanted to have a look at how digital technologies are shifting the world of work in terms of our models of operation. So over recent years, we've heard more and more ways to describe the process of offices going virtual, whether it's shifting from a physical office to working from home, working remotely, telecommuting, telework, or working virtually. And there are many, many fun myths out there that we can talk about and poke fun at home office environments and how home office environments could potentially challenge our level of productivity. For example, we've all heard of, well, more time for calling, texting, or video messaging with friends. Maybe playing a video game or two. A chance to get a jump start on those stubborn stains. Taking time out for the new Netflix series, or it might be rocking out to our own personal concert. So regardless of these fun myths, there are many, many benefits to actually working virtually or working from a home office, including some environmental impacts where we're minimizing carbon footprints in terms of minimizing travel, but also minimizing the amount of printing that we're doing, looking at e-documentation and different data storage options. But we're also looking at healthier work environments where we're looking at reduced stress from commuting and looking at the individual holistically in terms of creating healthy workspaces while also recognizing the importance of flexibility, given that we're working in an increasingly global context where timelines are blurred across geographies and time zones. And we're also recognizing that our personal lives are becoming more and more complex, and flexibility allows us to do our best in attaining that work-life balance. So here's a fun fact. Telecommuting was actually the original way of describing work from home. And it was a term that was coined by Jack Niles, who was a physicist and engineer back in 1973. And as a physicist and engineer, he was really focused on designing space vehicles and communication systems for NASA and for the U.S. Air Force. And it was through his work that he realized, and he began to talk about the importance of telecommunications and how it could really be the mode of the future in terms of replacing time-consuming commuting for staff. Since then, so since the early 1930s or 1970s, there have been three major waves of change over the past 30 years in terms of how knowledge-based work gets done. First, we saw the rise of home computers and email and how it gave birth to an army of freelancers offering both workers and employees new opportunities for flexibility. Next, we saw how mobile technology helped to facilitate global partnerships and gave transnational companies the same kind of work anywhere, work anytime flexibility. And now we're seeing ourselves in the third wave, where we're seeing new ways of providing that sense of community, that sense of shared office space, but through virtual platforms. And these in turn are helping us to find solutions to some of these side effects of increasing virtualization, which is isolation. And Kate and I will be talking about that throughout this presentation. But it also is a way of driving creativity and new models of collaboration. So as the world of virtual workplaces continues to evolve, there are about 4 or 5 different levels or options across the spectrum, from either going from not remote whatsoever to being fully distributed. And you can see those 4 levels on the screen. ICAD began likely at a level 1, where we had sometimes some designated remote days where people would work from home in order to plow through some report writing or focused work. But we're presently looking at a level 3 in terms of our team being in different cities, but still in the same time zone. We're also working at a level 4 in terms of how we engage and collaborate on projects with partners who are located in different time zones. So collaborating on projects with partners in different time zones. Each level requires careful thought in how to ensure smooth work processes, feedback, communication, and support. What we wanted to do today was to run through some of the key lessons that we've learned through our experience when transitioning from a physical office environment to an online office environment. First, I guess a little bit about why we did it. Well, for those of us who are less familiar with the work of ICAD, we are a coalition of Canadian organizations and individuals. So already we work at a national level. We are not a frontline service provider, so there really wasn't a need for any physical space. And as a national organization with a mandate that bridges both global work as well as Canada's domestic HIV response, we were already working across many, many time zones. We also found ourselves, as many civil society organizations do today, in an environment where there are fewer and fewer resources, particularly for coalitions and network-based activities. And so this, in order for ICAD to remain viable, strong, and be able to really ensure that we were meeting the results in a timely way, most effectively, we had to start thinking out of the box. And by moving virtually, with the money that was saved from the costs of maintaining a physical office space, we were able to reinvest it into programming. So moving right into some of the lessons, and we have about 4 overarching lessons that we'd like to talk about today. So the decision to move to a virtual office space is really not something that can be done overnight. It's a really very, very complex transition, and one that requires significant forethought. You know, pilots are important, but anticipate that even the best laid plans run into hiccups. For ICAD, it was, you know, the move involved as much thought about how we were going to structure our work together in the future as it was about ensuring that current workflows were not disrupted as we moved into that transition, or giving adequate thought to what we were going to do about all of ICAD's past work. So as you can see here, there are a number of phases that we went through as we were transitioning from a physical office space to a virtual environment, and figuring out how we were going to archive a lot of this historical data that wasn't yet digitalized. Although because of time constraints, we weren't able really to do a full-fledged pilot where all of us worked from home for a chunk of time before moving to that, out of our physical office space. We were able to ensure that everybody had an opportunity to try from home over an extended period of time, and we did this through a staggered approach. And really what this was to do was to help explore how virtual did ICAD really want to go. Is this something that was a viable model for ICAD? Did we want to go completely virtual, or did we want to look at something that was more blended in terms of having some teammates working completely from home, some perhaps working from partner organizations? And while there are a lot more shared lessons learned that you're going to find in this online resource, one of the most important lessons for us has been really around the importance of having defined workspace within the house. And really what that means is having a door that we can close at the end of the workday, or a space that we can move out of, that is a space that is designated for ICAD work and ICAD work only. And really it's a mental thing. It's being able to mentally close the door and say goodnight to work, and to be able to ensure that there is that distinct distance between work and your private life. And personally, for someone who likes to work at the kitchen table, I've realized that I really have to dial that back, because otherwise my work takes over the entire house, and that's not good for anyone's organization skills. The other thing that we found was the importance of really setting up our workspace before we got back into work. And this was important in terms of filing, but also mentally getting into our new workspace and knowing where everything was going to be. As well as the importance of saying that I'm going to work from home, even if we're already working from home. What we've been challenged with and continue to be challenged with is that there's this inherent feeling that we struggle, that if we don't respond to email or Skype chat messages immediately, then it must mean that we're slacking off. So it's important, even when we're working virtually, that we still have the ability to go offline and to work truly from home, to be able to plow through some of that focused work that needs to get done. So there are lots of other lessons learned. I'm going to hand it over to Kate, who's going to talk a little bit about the IT components, and then we'll cycle back to the final slides.
Thanks, Robin. So the devil's in the IT details. It sure is, and I think the start of this webinar really showed that no matter how much planning you do, sometimes there's glitches with technology, and oftentimes something's going to go wrong. And we planned and we planned and we planned. We worked really closely with our IT support team to make sure we had as much as we could possibly have in place for the implementation of our virtual office. But of course, throughout the process, we ran into some glitches, and I can talk about those a little bit. But I think the technology component is certainly the biggest piece of the puzzle moving into a virtual office.
Kate, I'm sorry to interrupt. Kate, I'm really sorry to interrupt. I just have a comment. Can you speak a little bit louder, please?
Oh, sure.
Okay, thank you.
Is that better? So I think one of the main lessons is around planning, and it's really critical to have the IT component mapped out in terms of the prep, the testing, the transition, and then into the full implementation of the virtual office. One of the things that Robin mentioned is that we did a bit of a pilot, and that really helped us to navigate through some of our options in terms of setting ourselves up in our home offices and what would work and what options we felt would be the best for us at the time. And part of that planning really requires really close communication and collaboration with our IT support team. It helps with the clarity of the process, to avoid some misunderstandings and how things are going to take place, and to ensure that everyone on your team understands sort of what's happening next in the steps, and at what point will they be affected in terms of their ability to work. And some of the questions that we had to go through were things like, what are we going to do about our phones? We are we going to have landlines? And we went through the process of finding out what the best option for us was, and we opted for voice over IP. And what are we going to do with our server for our data? Do we go to a cloud-based server, or do we put our physical server in one of our employees' houses? We opted for the latter, and that didn't work very well. We had some connectivity issues, and so we switched to the cloud, and it's improved our productivity, I think, tremendously personally, because our connections are basically always there. And even things down to, like, where do we put our office printer? We have a big monster office printer, and can somebody, one of the staff, can you house it in your basement or in your office if you have some space? And even down to communicating with each other and the IT support team too. Once we're fully virtualized, how do we maintain our communications and make sure that we're always able to connect with each other? We did run into some technical issues. I mean, after all, it is technology, and something will go wrong, and in our case, some things did go wrong. We planned, but we couldn't plan for infrastructure of houses and how the Wi-Fi connection would be within the neighborhoods, and the competition for the Wi-Fi broadbands and whatnot. Backup plans are really helpful, but I think in the end, if you have a really reliable and fast IT support team that can help you through all of these glitches, it's really helpful. And despite the glitches, we were able to keep things operating and keep things going. And one measure of success that we've highlighted on our case study, is that most people aren't aware that we've gone virtual, and that's a really good indicator of success for our process to the virtual model of operating. And I think if people aren't noticing, then we're winning in that regard. And lesson 3 is around embracing technology and our online tools. And we knew things were going to change for us in terms of communication, and even just the way we communicated even personally with each other. We weren't in the same office space anymore. And it wasn't until we went in fully into that virtual model that we really got it. And it wasn't a bad thing. It just meant that we really had to, it came down to embracing some new tools that we had never worked with before in order to replace the in-person aspect of how our team operated. So what we did was we turned to some online applications and some open source applications. Skype is our main mode of communication with each other. We do email each other, but mostly that sort of like one-on-one and team meeting sort of communication comes through Skype and the chat function there, as well as video conferencing. It's really replaced that way of popping our heads into our colleague's office to ask that quick question. And we started to work more collaboratively with Google Docs in order to, with our projects. And it helps to reduce the copies and versions of files that are floating around in our inboxes and on our server. And we use it as well to track our deliverables for during our team meetings and with our projects. And Robin mentioned collaborating with organizations across various time zones and stuff, and we adopted a team collaboration application called Slack that Sophie also mentioned earlier, and it was a really great way of keeping all of the communications and information in one place, and it's been a major project management and communication tool for the development of this resource, and it's really been the only way that our National Steering Committee and Sophie and I have communicated over the past year, except for a couple of teleconferences. We haven't had to meet in person in order to make this resource. We've done it all online. So I think it's important for the use of these tools is to have somebody within the team to be that champion of the new tools, to get to know them and to get the buy-in within the team, to try it out and to give it a go. But once you find the tool that works for your team, it can have a really positive impact on the way that your team operates. So Robin, I'll hand it over to you for the last lesson.
Great, thanks, Kate. I am conscious of time, so I'm going to really run through this very, very quickly. Essentially, the lesson is communicate, communicate, communicate. So this picks up off of what Kate was saying. I think, you know, forming and maintaining emotional connections is really important to do, even as moving from a physical office to a virtual office. It's also really important as teams grow and new people begin to join new project work. So what does this mean? It means embracing technology, but also finding moments to connect as a team face-to-face. It means using multiple platforms to communicate with one another and not just email or not just Skype, but to keep it interesting. There's also really, as this little cartoon illustrates, there's a heightened need for clarity around the objectives of each activity and who's doing what by when, so role clarity. We've done this through a variety of ways that Kate mentioned moments ago, through deliverable lists, Skype, online project management tools. But also, it's really important to keep everyone in the loop. So when we are sending out emails, let's copy everyone. It helps with project communications. Not only does it make sure that everyone's on top of what's going on, but it's also an important way to help reduce feelings of isolation, of not knowing what's going on or feeling left out of conversations. And then finally, really, really important to keep it fun and to make sure that there's still time for goofiness. So what we've done in the past is, you know, we have conversations through emojis or through funny Skype clips. We share funny YouTube vids. We have music swaps. We do online drinks together. Or sometimes we just put Skype on and work side by side, just to feel like we're working side by side another person. So I think I will leave it here. But all in all, you know, there are a lot of benefits to working virtually. It's not something that necessarily comes naturally, and it's definitely not for everyone. So it's really a matter of really process, consultation, communication, and understanding really the needs of each individual on the team and finding what works best for them in the new environment so that they can be the most successful that they can be at work. Thank you very much.
All right, thank you so much, Robin and Kate, for that great presentation and for sharing some of the lessons learned from the big process of growing from bricks and mortar to a virtual office. And of course, everyone can read more about this process on the resource itself and the ICAD case study. So I want to thank again Laura, Kate, and Robin for sharing some of their insights and for participating in this webinar. I know we've gone a little bit over time, partly because we started late. I see participants are hanging on, so I will allow us to take a few more minutes. It'd be great to have an opportunity to invite people to ask questions if you have any, for those who are still on the line. So we'll invite your questions either in the chat box or by using the mic function. You just have to unmute your mic in the upper left-hand corner. I do want to remind everyone, however, that this webinar is being recorded and it's going to be shared on the YouTube channel of ICAD. There is not going to be any, the video is only going to show the slides and so on. There won't be any names indicated, but in case that's a concern, then you may want to just send us your question via chat as opposed to speaking using the audio function. So with that, are there any questions or comments to our case studies or to Kate and myself about the resource?
Hi, I see that there was a question from Marc-Andre that I can address. Was largely just around the contribute to social media. And what we chose to do here at HIV Edmonton is it's myself, and then sometimes I had a volunteer coordinator that just left on maternity leave. But so really there's myself and another person, and we manage all of the social media. However, the way we do it as a team is that people send us things, but to have we found that to have other contributors is that there was too many cooks in the kitchen, and sometimes our messages were unclear, or
unfortunately, we seem to have lost Laura, or...
Laura, just activate your mic again.
For me?
There you go.
I think I did. Am I good?
Yes, we can hear you, Laura. The last thing you were saying was that there were too many cooks in the kitchen.
Okay. Yeah, so what we found was that the messaging, sometimes you would post and then we would post again about something else or something completely different, or there wasn't a good theme kind of going. And so we find that keeping it, the actual posting to a minimum, so it's largely myself, or if I'm not here, I designate someone to do it. And then, but the actual content comes from our entire team. So when Brooke is out doing education, or people are doing things, or we have a client activity, they all contribute to what we want to post as a team, but that the person actually clicking and writing is generally either myself or my or the volunteer coordinator. Does that help?
Thank you, Laura.
Mm-hmm.
Yeah. Marc-André says very helpful, thank you. Are there any other questions or comments? All right. So with that, I certainly invite you, if you want more information and if you haven't already done so, or even if you have already done so, I certainly invite you to go and visit the site. There's a lot of information on there. You can find out more about the case studies and some other information that we've discovered as we were moving forward with this process. We also have 3 more case studies that will be coming out soon. One looking at the international advocacy work of Health Gap, the use of WhatsApp to mobilize young people in Zimbabwe. So 2 case studies that are going to be focusing specifically on politics and using WhatsApp specifically. And then we're going to be looking at APCON's Suck, Bleep, Test, Repeat campaign in Bangkok, a great campaign that's been encouraging young MSM to seek HIV testing services, and to look at the different prevention options that are available to them. So stay tuned, these will be coming out shortly. If you have any information, I see that Laura has shared her contact information in the text box. You can access our contact information via the website itself, and as well, of course, get in touch with ICAD and go check out ICAD's fantastic new site as well if you haven't already done so. So with that, I want to thank everyone who participated in today's webinar. Thank you so much for attending. We know that this is a very busy and hectic time, so we really, really appreciate your presence. I also want to thank our speakers, Laura, Robin, and Kate, for also taking time out of your busy schedules and for sharing those fantastic lessons in the case studies. And by all means, to everyone, do help us to promote this resource, to evaluate it and evaluate this webinar. You'll find the links in the next slide. And we look forward to being in touch. Thank you very much for joining us today, and take care.